Is it okay to take your blood pressure medications only when you need them? Say, only when your blood pressure is high or when you feel your blood pressure is high. Maybe if you get certain symptoms or things like this, a headache or whatever, you're wondering if it's high, and so you say, oh, I need to take it now. Is that okay to do? Also, is it okay to stop your blood pressure medications once your blood pressure improves? These are questions that you guys have written in the comments. These are actually things my patients have asked me. We're going to talk about them. First of all, I want you to know blood pressure, just how important it is, very briefly. And I've got plenty of videos about blood pressure, so I'm not going to go into the whole thing. But blood pressure, keeping a healthy and controlled blood pressure is literally one of the most important things we can do if your blood pressure is high. The reason why is because uncontrolled blood pressure can cause strokes, can cause heart attacks, can cause kidney damage, can cause so many things. In fact, having an uncontrolled blood pressure can be literally downright deadly. And the thing about it, guys, is that, and I've said this many times over and over, but high blood pressure often isn't felt. Okay, you can, many people walk around with super sky high blood pressures and don't feel a thing. That's not uncommon. So let's go back to the question. Let's start with the second question I asked, which is, let's say you've been taking blood pressure medications. Your blood pressure is now under control. You've been seeing your doctor. They're pleased. You've been checking it at home. It's normal. Can you now stop your medications? Well, the short answer is no. And the reason why, for most people, that the answer is no is because probably what's keeping your blood pressure controlled is the fact that you're on the medicines, okay? Unless other things in your life have substantially changed, other underlying conditions have been resolved. Maybe you've lost weight, you've changed your diet, other major things have happened. It's statistically unlikely that you will no longer need your blood pressure medications if you have before. Now, I am not your doctor, and I don't want you to feel hopeless. Let me tell you, there are ways of being able to come off of blood pressure medications, and there are things you can do to help get you towards this path. But let me tell you, number one, this has got to be only under doctor's advice. Number two, there are some people that, despite their best efforts in terms of doing everything, they have such a strong genetic component of high blood pressure that even with the best diet in the world and the best weight, et cetera, they still have high blood pressure and still need to take medications. So I want you to understand that and not feel discouraged if that is you. But the short answer for most people is, if your blood pressure gets better, can you stop medications? For most people, that answer is no. And you certainly shouldn't stop medications on your own. If you're interested in stopping them, you've got to talk to your doctor so that you can understand what the options are and why. Let's go to the first question, which I really asked, which was that some people tell me that they only take their blood pressure medications when their blood pressure is high or when they feel they need their medications. Is this okay? The short answer to this is no as well. The reason why is because if you're only taking your blood pressure medications intermittently or every now and then, the likelihood is that your blood pressure really is not controlled most of the time. Okay. If your doctor put you on high blood pressure medications, the assumption is that your blood pressure is high. So if you're not taking your meds consistently as they were meant to be taken, you're not going to get the full benefit of that medication, and your blood pressure is still going to be high, perhaps in between you when you choose to take the medicine. The problem with that is it puts you at risk for the things I talked about before: stroke, heart attack, kidney disease, and so many other things. That's not helpful, and that's not wise. In fact, it's really something that you shouldn't do. And if you are doing this, what I would say is talk to your doctor about it, okay? Talk to your doctor about what you're doing, what you're not doing, what you're comfortable with, what your questions are, what your concerns are. Let me know in the comments if this video was helpful. I base a lot of my videos on things you actually write me and things I see in the office. This is where this video came from. So let me know other questions you have, other comments. Please share this video with other people you think might benefit from it. I'm just really hoping to spread the word as a family doctor. These are conversations I literally have every day in the office. For those of you on Facebook, by the way, I'm Dr. Jen. Hi. Please like and follow my page. For those of you who send stars, thank you so much in advance. Also, please consider joining my exclusive group, Dr. Jen Superstars, for exclusive content on YouTube. Hello. Please subscribe to my channel. Click the little bell for updates. And guys, check out drjencaudle.com for my free daily health newsletter and so many more offerings. All right, guys, I'll talk to you soon.